The one that I'm bringing to you today, and I talked about it in the email a little bit, is about how your team speaks about you and your practice and what you do every day. It's something that I think some practices do a great job talking about and training on, and a lot don't. It's important to always keep in mind and remember that words are incredibly powerful, and our teams are such a phenomenal resource when it comes to internally marketing our practices, meaning they are the ones who share the love, shall we say, when other people come into the practice, and then the words that they use encourage others to maybe speak highly of us, remind them that they really do like us, so maybe they'll say something nice about us, so that the word spreads about all of the awesomeness that's happening in the four walls of your practice. So I want you to think about for a second, what are some phrases that your team uses on the phone with new patients? What are some things that you hear them routinely say when someone walks into reception for the first time? Do you have any phrases you routinely hear when someone is presenting treatment or talking about treatment to a patient? The other question is, do they have scripts that they're working from? So have you guys sat down maybe as a team or a group and come up with guidelines around the things that should be said, in what order, any of those things that they're working from? Has there been training around the language that they should be using, how they should be speaking about things, or are they really just winging it every day? And I know for a lot of practices, especially like the receptionists, are really just winging it. They're just hopefully friendly, happy people, but they're just winging it. And winging it, although at times is great, isn't a great way to have successful systems in the practice that will have the effect that you're looking to create. And one of the biggest takeaways from this conference, and from actually everything that I've implemented and learned over the years, is that if you don't design it to do the thing you want it to do, then it's not going to do that thing reliably, consistently, or effectively. And when we're owning, running, working in a dental practice, as much as people hate this word, but our patients are buying dentistry, either themselves or through their insurance or some fashion, but they're buying dentistry just like they buy everything else in their world, meaning they have choice and they get to pick who they buy it from. So how do people make buying decisions? Well, we usually buy based on emotion way more than on logic, and we tend to buy from people that we know, like, and trust. So we need to take every opportunity we can within our dental practices to make sure that we are instilling or inciting the right emotions from our patients, and that we are giving them enough opportunity to share positive words, to share experience with them, so that they feel like they are getting to know us and that they like and trust us, right? We have to be able to facilitate that. We have to be doing things to try to make that happen. And we're not going to get into the full weeds today of like sales psychology, because that's a big long talk. We'll do bits and pieces over time as I do videos, but we're going to start where it's easy, because I like to give you things that you can just take and implement. So you can literally start changing this today or tomorrow or next week, maybe stew on it for a couple days. So the words we choose to use and the words we teach our team to use are incredibly powerful. Research even shows that if someone knows that a script is being used on them, so they are very well aware that someone is like memorized things to say to them and they're saying a script to them, even when we know that, we still tend to believe them and trust that their words are true, even if we know it's a script, right? It's human nature. We hear certain words, certain phrases, the way things are spoken about, and it leaves an impression on us and we believe it. Somewhere deep down inside, we believe it. So let's look at different areas of the practice and what words you could be using to help build your patient's trust, like the know, like, trust factor, and make it so that they're more likely to say yes to you and to your team, right? And hopefully to refer other people to you, speak highly of you in the community. Let's talk about phone calls first, because Phone calls, and I know I talk about phone calls a lot, but if your phones at your front desk are not being managed well, you're just flushing money down the toilet. So when people answer the phone and they're talking to, especially new patients, but this could be anybody, are you hearing comments like, "Oh, you've called the right place," or "Dr. Smith is wonderful, you're going to love her," or "This is the best dental office in Calgary"? I know, I've worked in many places. Your team should be trained on the new patient intake call, and they should know that as they probe for the reason why someone is calling, they should be making a reassuring statement about getting in touch with you. So they should be saying something, they're going to dig, they're going to find out why this person wants to come see you, what is the motivation for the call, why are they reaching out, and then they are going to make a bragging statement about you. They're going to tell them that you're really great at that, or the doctor really loves working on X, or that is our area of specialty. And you're maybe going to have to role play this with some of your team members, because getting people comfortable with this language of speaking highly, positively, passionately, enthusiastically about your practice for some people is not natural at all. And you want them to have like many options they could pull from depending on who they're talking to, the type of energy of the other person, what it is, the reason is that they're calling. And you want them to have like voiced it, practiced it, said it, brainstormed with other people so that they have a bank of phrases that they could pull from, so that they're not trying to like wing it and come up with something on the fly, because that doesn't generally happen. So they're just going to go to their natural tendency, which is usually not to. Because some people will say, "Oh, I just can't brag like that," or "It feels too forced," or "It's not my normal language." And it's just because that's not their normal way of communicating about the office. No one's likely ever asked them to do that before. They don't have practice with that kind of language, and people will shy away from things that feel new and uncomfortable. That's human nature. Just accept that that's the case. So it's your job to help them get comfortable with that type of language if you want them to use it. And that means likely brainstorming, role-playing, coming up with lists of things that they could possibly say. There is nothing wrong with using positive, enthusiastic language, right? It has to be statements that are true or that you believe to be true. So this is where brainstorming comes in, because you don't want to say to someone they called about their wisdom teeth and you specialize in wisdom tooth extraction if you refer out 100% of your wisdom teeth extractions. That would be lying. Not a good idea. And so you're also not going to say things like you guys provide the best customer service in town if you actually know that not to be true. Hopefully that's not the case, but if that's not true, don't tell people that. So you get the team together and you guys brainstorm. What are all the things that you could honestly say about how awesome you are, the doctors are, the team is, about what you do, about how you treat people, and come up with as many positive statements as you possibly can that feel genuine and authentic. Because these are the statements that you can give your team permission to use in as many instances as possible. Yes, new patients, I always stress new patients, because once you make a great first impression, they're likely to stay with you forever, but you can do it with existing patients as well. Maybe you're an orthodontist like me, or maybe you have a treatment coordinator position that orthodontic offices often have, but maybe you have that in your practice. And that person that treatment coordinator role, that person has to very quickly build some rapport and trust with your patients when they first come in, right? So they probably should have a few statements that are going to help to build that rapport and trust. So maybe they can think down this line. Have they worked other places? Do they like working with you better? If the answer is yes, amazing. Have them tell people that and tell them why. A personal statement is a very powerful thing. It only takes a few seconds. It's something that they can come up with that feels genuine and honest to them, and it can completely transform an interaction. A doctor can't come in to the room and brag about themselves. That's not going to go over well. But when the team takes the time to say some really positive things about the doctor themselves, or about the work that's done at that practice, or about the fact that they've worked in 3 other offices and this office is the best by far and this is why, that means something. So we do this because once the know, like, trust factor has gone up, once someone has decided that they've made a good decision by coming to your practice, then they're going to forgive you for little things. I've spoken about this before. Then on their second appointment, if you're running 10 minutes behind, no big deal. Something funny happens with paperwork, no big deal. because people will always look for evidence to support a decision and a choice that they've made. So you want them to decide right away that they really like you. Help them decide that. Tell them why you're awesome. Tell them the good, amazing things that you do. It makes sense to put great effort into this for new patients because you always want to be going above and beyond. You want to design the experience that your new patients are going to have through your practice. It has to be intentional and on purpose because once you've won them over, you have won. Right? Of course, you're always going to treat people kindly and with respect, and you're going to show them that you care. But the hard work is on the front end, is on getting them to commit to you and then to stay. So let's go back to language and its power for a second. You can reassure and impress new patients on the phone. You can do that when they come in for their new patient appointment, so when they walk into reception. You also have an opportunity when you do follow-ups. Let's say someone comes into the practice and you present treatment and they can't do anything right now. They haven't made any commitment yet. And so you're going to follow up with them robustly, right? The money is in the follow-up. You should be following up with people until they tell you to stop. So this could be by phone, text, email, or all three. Are you explicitly using your words to tell them that you care? Do they know that you genuinely want to help them achieve their goals and that you can because you've done it before for other people? I want you to look at the things that you send out to people. So things that go out via text, via email, like any sort of written information that goes out. What are you saying? Where can you improve it? Where can you add the touch that will make them think, wow, like, yeah, these people really do care. I do like them, right? I hope this gives you something to think about. Language is so important. And although we usually work really hard to train our team on the tasks that they have to do, all the specific things they have to get through in a day, the words they are choosing, how they are choosing to use them are important. And you can design that to a certain extent so that it's having the effect that you want it to have. So this is a phenomenal exercise for your next team meeting. Get the whole team together and start to brainstorm. It's such a great feeling thing to do. Let's talk about all the good things we do. Let's think about all of the ways we can speak highly about each other, about the practice, about what we do for people, the lives we transform, you name it. If you can think of it in a positive light, write it down and have everybody work on phrases that they can use that can pass that information on to other people because they won't always know unless you tell them. So, take action on this tomorrow, next week, whenever, and go kick some butt because I know you can all do that. And to be honest, if you ever want to chat about something at your practice that you want to work on, that isn't going well, that you'd love another perspective on, I am always happy to share my perspective and offer insight, especially if I've battled or been through that same thing, and most of the things I probably have or am still going through. You can book a coffee chat in my calendar anytime. You can send me a DM, you can email me, any of those things. I would love to help you dig in and solve something. I do that for anybody who asks for my help. It's free, in case anybody was worried about that. Send me a message. I'm happy to point you in the right direction. If you remember, I would have sent you a welcome message when you first joined the group. The link to my coffee chat's in that message. But if you want that link again, just comment down below this video and I'm happy to send it to you. Otherwise, like I said, send me a DM, send me an email, and I'm happy to help. Otherwise, I guess I'm going to try to come up with some more good nuggets for you, and I'll see you next week. Bye-bye.